Today we're doing something a little bit weird. I'm going to be putting in some Google searches and I'm going to tell you what I think about it. So here we go.
Welcome to Salisbury Eyecare and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 4 p.m.
We're doing a Google search, not my Google search. We're searching some stuff, some things that people Google about eyes and eye doctors and eye stuff and eye things, and I'm supposed to react to it, I guess. I don't know. We're going to do it. Okay, so here's a good one. I love this one. How do optometrists determine prescription for babies? Babies. And the implication there is like babies can't talk to you. They can't tell you which is better, one or two. So here's the thing with all testing, right? So like there's objective testing and there's subjective testing in healthcare and eye care and anything. Subjective is what the patient be telling you. Okay, that's like everything I gather in my history, all the things. And then there's objective testing, and those are the facts, man. Those are all of the facts. And so when you're talking about babies, like I ain't got a whole lot of the subjective and I got a whole lot of the objective. And so we have different ways. We have a retinoscope in determining prescription for babies, and what it does is it bounces light off of the back of their eye. So I get the little babies in a room with like something fun going on behind me that they can look at. I shine this light in their eyes, and by the way it bounces back at me, I'm trained to know what it means and to know how many lenses to put in front of them. And that's how I determine their prescription. It's a whole different process than an adult, but it's very, very accurate. And it's really cool. It's actually really cool. How do optometrists test for glaucoma? There's a few different ways. So if you've heard of the Eyewear test, that's kind of an older school thing, but it's called non-contact tonometry, NCT, but that's the Eyewear test. And any of these devices that we use are like, in that case, it's pushing air at you with a certain sort of velocity, and it's measuring the bounce back, how much pressure is bouncing it back. And so that's how we test pressure, but there's different ways. Like I have one that's mounted on my equipment, my slit lamp, and that's kind of my favorite one. It's called a Goldman tonometer. And then there's some other ones. My technicians use an Eyecare tonometer, but again, the concept with all of these is like you're exerting some pressure, whether it be with a probe or air, and you're kind of testing how much pressure comes back. So that's pressure testing, and this is asking how optometrists test for glaucoma. It's not quite that simple. We also are watching your nerve, your optic nerve, and its health over time. So I have some specialized equipment that helps me look at that. I also measure your visual field and your visual function. Again, I have some specialized instruments here that help me with that. So glaucoma is not a quick, easy one test. It's a number of things that help create a clinical picture, and then I use my clinical judgment, and that's how we test for glaucoma. Yeah. Well, that was certainly a lot of fun, and I hope you enjoyed this video of me looking at Google searches. We have new videos coming every Wednesday at 4 o'clock, so hit that bell, like, subscribe, do all the things so that you never miss a video. See you next time. Bye.